Hello everyone, let's get started. Welcome to part 2 for the vital signs. We're going to talk about the pulse. And if we have more time, we'll continue on. Okay, so I wanted to pull this from your chapter on page 487. And know this, it's in the PowerPoint also, but I wanted to back it up with the knowledge from the book as well. The pulse is a wave of blood created by contraction of which ventricle? Because you'll be asked, is it the left or the right ventricle? The left ventricle of the heart. Okay, and as you read, generally the pulse wave represents the stroke volume, output, or better known as the amount of blood that enters into the arteries with each ventricular contraction. Boom, 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 boom. The ventricles are at the bottom, remember. Your two ventricles at the bottom. So, this is how and what a pulse is. Now, when we become older, and like our older population, when a person's arteries lose their distensibility, as can happen with age, greater pressure is required to pump the blood into the arteries. So just know that with our older adults. I also wanted to point this out. I was unable to get it together. But know when we're asking about your peripheral pulses, your apical pulse, and of course, which you already learned, your point of maximum impulse. So know this. So when we're saying check your patient's peripheral pulses, I don't, you just listen to the apical pulse. I'm speaking of peripheral pulses, away. Okay. So make sure that you look at this paragraph here, and please take heed. I spoke on this slide already, but let's look at what we need to do when we're checking a pulse. Now, there are things that we need to do. We need to also make sure we look out for the characteristics that should be included when assessing a pulse. And those are, you're assessing for the rate, the rhythm, and the volume. I want to reassess rate, rhythm, and volume. So when we talk about rhythm, we're talking about the pattern of the beats and the intervals between the beats. So when we're talking about pulse volume, which is also called we're looking at how strong it is, how strong the pulse or the strength or the amplitude. It basically refers to how strong that pulse is when you're feeling for it. And then also we're talking about the arterial wall, which looks at the elasticity. Okay, so I wanted to mention those things, and I apologize for stuttering so much, but I did want to mention those things and not let this go without telling you that. I thought I'll pull some blurbs from the book so I make sure I don't confuse anyone. The pulse rhythm is here. Please read that. This is also your pulse volume, so no confusion. Please read this area. This also talks about your peripheral pulses and how I'll always reinforce whatever you do to one side of the body, you make sure you do it to the other, and you're comparing your data that you're receiving. Let's try a pulse check. See if you can find your pulse or a friend, family member, or your child, someone, and see if you can find all these pulses. If you have further questions after your on-campus clinical that we did, you still can go to your ATI and look at the videos for assessing the pulse sites. And I also thought I would put this nice diagram from your book on the pulse sites. There are 9 sites, you guys. 9 sites. So check out the 9 sites. Temporal, carotid, apical, brachial, radial, femoral, popliteal, posterior, tibial, and your dorsalis pedis.